Hey, everybody, welcome back to In Good Hands. And I had such a special guest today. Before I get into that, though, I do want to start this episode off with our disclaimer. The contents of this interview is purely for educational purposes only. Dr. Botha is not being compensated in any way for this interview. She's taken the time out of her day to share her thoughts and opinions after I requested this interview from her. None of this content is meant to diagnose, cure, or treat any condition, and always consult with your medical provider for any health concerns. So, today I am excited for this interview, bringing it back after taking a long hiatus because I happened to meet Dr. Botha at an event that we were both attending in Atlanta. And I love that I see her at these events, and we didn't even know that we are going to be there at the same time because she is already one of those doctors at the top of her game and continuously learning more and more. So that respect is already there. But I happen to have a special place in my heart, as most women do, for OB-GYNs. And I'm going to start there with her bio. So Dr. Botha, she's a board certified OB-GYN specializing in root cause medicine, hormone optimization, regenerative medicine, and minimally invasive cosmetic surgery. With over 15 years of experience in bioidentical hormone therapy, she believes lasting health and great aesthetics outcome both those outcomes begin at the cellular level. Her practice combines hormone optimization, gut and microbiome health, genomic guided personalized medicine, peptide therapy, advanced diagnostics, and regenerative treatments to help patients age healthier from the inside out. She has a particular focus on membrane and plasmalogen health as a foundation for brain, metabolic, and healthy aging. In addition to caring for her patients, Dr. Botha lectures internationally and mentors healthcare providers, training clinicians in the science behind cellular health and longevity. And her mission is quite simple: to help people feel as good as they look and live longer, healthier lives. And I think as women, we all love our OBGYNs, especially but they're boss ladies like Tracy Botha. I feel like they truly get it, right? They've lived it. This mutual understanding is truly unmatched, woman to woman. So from the get go, Dr. Botha has been up there for me. And just the cherry on top, she has this thriving practice in Gainesville, Florida, the Moy Medical Spa. We're going to start there. I would love to start, Dr. Botha, with what you do today, not hitting too much of your background because I've got pointed questions about that, but what you do in today's practice, I would love to know.
So my goal is 360 care for sure, just like what you said. I love to treat the whole person. I love it when patients come in and I guide them through feeling good and looking good at the same time. And I think our skin is really a reflection of our cellular health. And so I love relationships that I have with my patients. Many of them I've taken care of for over 20 years. And I love when they come in and they bring their family or their friends. And that's what I have here, and I try to help them in any aspect of their care, as well. So that's what I've created.
We actually discovered just our mutual love of the skin and, of course, aesthetics and all these things. We were just, like, rifling off on our fingers, like, our favorite
Right.
outfits, and then the ones that we didn't like. So, as an added
Right.
bonus, I have a whole list of, like, the top, non-invasive procedures that
Mhm.
we as women might consider doing, and she's gonna be grading them from A through F. But before we get to the good stuff, let's learn more about your background now. And
Absolutely.
I think that's what's hooked me on to Dr. Botha the most was how much you had gone through just in your own medical space and why that shaped you into what you're doing today, which is so off the cuff. It's not, it's off the beaten path. You're not following what you learned in medical school. And there was this big fork in the road. So I'd love to kind of
Absolutely. Yeah. So I actually was born and raised in South Africa. And, South Africa it was back when apartheid was in full effect, and I was raised in a community, that was very segregated. I was fortunate enough to go to a school that was very diverse, and, I had a dad that was abusive, both emotionally and physically, and so women's rights were very different. I was able to come to America when I was 12, and I saw how different America was. and it blew me away. I felt that this was a country where you really could become anybody you wanted to be, and women really had opinions. And so I stayed for a year, went back, and I promised myself that one day I was going to come back to the United States and I was going to be a doctor. And that's kind of what drove me. I actually, women's health was my part of my journey. So I moved over. I went to community college, undergrad. I was a domestic violence counselor and a rape victim advocate. And, leaving South Africa with my mom was, like, the hardest thing I ever had to do, but I cried myself to sleep every night, but I knew it was my only escape. So that's how my women's health journey started, and I think everything I did kinda brought me on that journey. I always had great relationships with my patients. Um, I actually had incredible colleagues and patients who found things and brought them to me. So that's how my hormone health expertise got started. I had a patient who discovered bioidentical hormones on her own, and I saw how she changed. And finally, she told me to figure it out on my own, and that was 18 years ago. And so that's kind of how my cellular health started. I loved aesthetics. I loved cosmetics. I loved our situation of being able to support patients. Like you said, your OB-GYN is your best friend. And so the breast cancer is something that happened around 7 or 8 years ago. And that's where I actually had complications from my mastectomy and reconstruction, and my body was never the same again, and so I had to change what I could do, and I think it also made me reach out and find out more as far as my understanding of my body, and, when you go through certain things, it makes you understand other people better. So I think women's health and cellular health has really come together for me, and I want to help the entire person. And I have patients who go to 5 different doctors and nobody listens and nobody seeks out what that is to be healthy and how you can get to that. And that's kind of my journey and how I got here.
Oh, that's
A long-winded journey.
my
Yeah.
oh
And
my
it's ever
god.
evolving. I think I'm so lucky. I mean, I met Mike, I met you, I met Dr. Khan, I met Anne, and everybody has helped. We help guide each other. I'm the hormone expert, right? Everybody calls me and asks me and that, and I feel like your community has helped me have this whole other community, and we talk on a daily basis and converse and really discuss patients, and I feel like it's been an extended brain for myself of family and care.
I love that the hormones that you've been specializing and lecturing in now was brought to you first by a patient, which is well,
Yeah,
that's like being dismissed by our doctors when we're bringing up something we
absolutely.
haven't heard of, especially something as dicey as, hormones, which how
Yeah.
rap, I want to say like 18 years ago, it was
Mhm.
eyes, wasn't it? Especially
How about 2 years ago?
uh,
I mean, it's only been in the last year that now the FDA has come and said, "Hey, maybe estrogen doesn't cause cancer." So, I mean, there's still physicians out there telling patients that this is not something they need to do.
uh,
Well, so absolutely. Hormone health is everything. And honestly, before I did cellular medicine, I said I saved lives in marriages because I really believed that hormones were the only things you need to do. And then I realized I had all these patients that I optimized, but there was something else. Like they weren't getting better. And that's when your world comes to mind. And it has absolutely transformed my practice to be able to really help many patients get better with fixing, that root cause.
what a beautiful segue, because my next question to you, like, how did you find Dr. Ganya and why did it matter to you? Like, what was that light bulb?
Honestly, I just feel so fortunate to have found all of you. So I saw him at a conference, and, I remember kind of being blown away by what he showed, and my mom started to have signs of dementia. So I wasn't even thinking about it for me or my other patients, and I got online. You have your community where doctors can come and learn, and so I started to listen more, and I ordered the plasmalogen, capsules and the test. And that's when I started. And within 4 to 5 months, I noticed that my hormone, I had a lot more testosterone resistance. And we can talk a little bit about why that's important. But I noticed that my levels came down. I didn't need as much. My thyroid function improved. And I didn't understand what all this was. And then when I became a provider with you guys and I had a better understanding of what was going on, I realized, well, my receptors improved. I didn't have receptor site resistance. So as we improve our cellular health, we don't need as many like extra things, right? Our thyroid starts to work. We get optimized. And so sleeping was better. I mean, just those little things made such a difference in my life and I was blown away.
Oh, well, that's fantastic. Well, so good job, Dr. Goodnow.
I know. And thank God for him, right?
And then I want to say that this came completely unprompted when we saw each other at the last conference. But you said that you do not, and we haven't even touched upon how you got into cosmetic surgery, by the way, but you said that you don't operate on people unless they take plasmalogens, which I was like, oh my gosh, like, why is that? Like, tell me why. But I would love to hear again if you don't mind.
So I'll clarify. So I am very strict in when I do elective procedures with patients. I make all my patients do a complete blood panel, make sure they have micronutrients. I mean, half the people I check out there are scurvy level vitamin C. And so your results are as good as your micronutrients and your health. And so when I have a patient who has more inflammation, who has more chronic disease, then I do suggest that we do the prodrome test. If they're young, so less than 40, if they don't have chronic disease, then no, then I just do I have a pretty substantial panel, look at their if they're methylating, look at their vitamins, make sure they don't have diabetes or insulin resistance. But if they are and they have inflammation, then I'm not doing them a service by creating more. And so what I've noticed over the past years is my results are fantastic. And it's because my patient's health is optimized. So even my patients who have autoimmune illnesses, they're doing well. And I choose things that aren't going to overstimulate their immune system too. So I'm very careful in my choices. Like I love biostimulators, but I'm not going to give them a biostimulator that is immune modulated. I'm going to give them one that's more structure based. So I do think aesthetics were a doctor first. If you want surgery, this is what you're going to have to do to improve your health. And she did it. And she's so happy. And her results, normally regenerative medicine and energy devices take 4 to 6 months to have incredible results. It takes a while to build collagen. We started seeing results with these patients at 1 to 2 months. Um, I mean, it's been unbelievable. And I really think if you have good cellular health and your body can make collagen and you have all the resources there, you're going to just get better results.
Oh,
So yes, that's why. And generally it's not a you have to, but it's I really think if you're gonna spend all this money,
yeah.
this is what if you do this, and it's less. It's not this big surgery. It's an energy procedure where your skin just gets better over time.
That's incredible. So people are coming to you to get something done and they want it now, that instant gratification, but you're telling them to wait and
Yes.
fix the thing first, optimize
Yes.
first. Like how long does that go? I'm sure it varies patient to
I mean, generally, yeah. So it depends on what's going on with them. Um, It depends on what they're doing, and so this particular patient was really overall healthy. Her plasmalogens were really, really low, and she wasn't feeling great, and so what we did was she did a bottle a week of plasmalogens for a month. We also did, stem regen, which upregulates your stem cells, so healing was better, and just even post-surgically. So your pre-treatment and your post-treatment are just as important as the procedure. And so I have a great team that takes care of my patients, and my therapist was blown away
go.
by the difference in the healing of patients, and they don't need as much. So recovery is incredible, and they're so happy. So when you explain it, you have to have the right person, right? I mean, people who find me are people who want to be healthier. They understand that things don't happen overnight. Like feeling good is not a switch. It's something that improves over time. And so I think when they understand that, then the end result is worth the things you put into it.
Yes. Okay. So what are some of the common like skin misconceptions that you often see in your patients and your practice that you generally want to fix first?
Yeah.
Yeah.
So I think even as a physician before, I didn't understand that our skin was a reflection of our health. And so like rosacea or hyperpigmentation or melasma, it's all inflammation. And so yes, you can do lasers and yes, you can do energy devices, but if you want long-term improvement, you've got to fix the gut and you've got to decrease inflammation. And so that's, I think, things that I try and educate patients. So when I have somebody comes in and they want IPL because they have rosacea, I mean, I will do it, but I'll talk to them about what we need to look at and what we can do to improve that long term. Even like my surgical patients, right? If I have a young person in their 30s to 40s and they're not on hormone therapy, they're not on testosterone, I talk to them about the importance of androgens in building muscle mass and continuing to improve and lean out and feel better, optimize their sleep, optimize everything. So that's my goal is teaching you about your body and how we can improve long term, not just this month.
There's so many misconceptions that you just
Yeah.
blew it out of the water for me. Like, particularly the melasma. I thought that was a genetic thing and a sun exposure.
So it is. It's
Yeah.
hormone related, but it's heat related and it's inflammation related, right? So it's related. Usually women who have melasma have more insulin resistance. They have a family history of metabolic syndrome, more PCOS androgen dominance, right? They're not necessarily, it's atypical for a lot of women. And so if we can fix the inflammation and the insulin resistance, and then if you address the inflammation even by doing like a hydroquinone or something prior to treatment, and then we continue post, they're going to have less hyperpigmentation happen. So you have to look ahead, right? People who have a higher risk of hyperpigmentation, if we know ahead, and that's why I like to see my patients before I don't let them just book whatever they want, because I need to discuss with them what their end result needs to be and how we can achieve that and looking at their skin and seeing what's going on. So really, I think aesthetics, your doctor first when it comes down to it. And it's so, so important to be connected.
Oh my gosh. Like I've been to so many aesthetics clinics where it is truly like get in, get out type of thing. This
Right.
is not that kind of shop.
No,
This
no,
you're investing in each person coming in.
absolutely.
Okay.
Absolutely.
We need more Dr. Bothas here. All right. So I have more
Oh,
questions because like that was like not only my own personal my interest, but also I feel like more women need to hear this.
absolutely, ma'am.
What are your biggest recommendations for sun protection?
So I have a very sensitive skin. I'm right there, PCOS, melasma, rosacea. And so I think the bare minimum. So micronized zinc oxide is really the only thing that I personally can use and I recommend. A lot of products have things that inflame your skin. So that's what I recommend. Here I carry Tizo and I love that. But I think micronized zinc oxide is really all we need.
Micronizing zinc oxide. Okay,
Yes.
very good. And then what do you recommend for your daily upkeep for skin? Like must-haves would be great too.
Okay. Again, sensitive skin.
Yep.
I use mostly serum. So a mild cleanser, I double cleanse. I love a salicylic acid toner. It's really good for our pores. I honestly love SkinCeuticals. They're medical grade. They have something they call Botox in a bottle, and it's called Petox. It has niacinamide in it,
Mhm.
and it's very good for fine lines and wrinkles. Definitely having a vitamin C is good. It helps with skin tones, helps give you a little bit of a glow. I love their ferulic acid, and then of course you got to put your sunblock on. But that's my must-haves. I do that on a daily basis and absolutely love their products. They don't smell great because there's medical grade, so I have to warn people. You don't want something to smell good. You want it to actually work, and if you do that, like your skin is going to be great.
Oh, I switched for non-fragrance, no dye
Yeah.
type of products as oh, I'm with you, Dr. Both.
Absolutely.
What about this rumor that I don't know how you feel about it, but like your skin gets used to something? Is that a thing? Like, if you constantly use it.
So, I mean, I think certain things are inflammatory. What I have found, I always say I'm a barometer of anything that's not good for your skin. And so I think a lot of products have things in it that are not good for you. And so you can actually, there's an app, Yuko, where you can scan a lot of things and look at what's in them. So I do think that, but I think for me, it's things with benzene. I mean, there's certain products that feel like a chemical burn and my skin looks like rosacea and I cannot use. And so I I don't think overall if you have a good product that that's the case, but you don't want to use something too harsh on a consistent basis either.
Very good. Do you keep your skincare in, like, a fridge? Or
I do.
okay. Alright. So we're gonna get real skin girlies. We gotta invest in that.
I know, exactly.
Okay,
Yeah.
very, very good. I love that. What about masks? What are your thoughts on masks?
The red light masks or
The
just
masks, those, like,
the
Korean.
hydration.
Yeah.
I think they're great. My daughter does them all the time. I honestly forget. I don't do it. I think anything you do consistently is gonna be wonderful. Anything that hydrates your skin.
Very good. Alright. So, we do have a whole long list of stuff coming. This isn't it, by the way. These are just extra little bonuses. So what procedures have been become dramatically more popular in the last few years that you've noticed?
I think microneedling radiofrequency had a while there. Laser treatments, I think, are super popular, um, particularly like Pico, where it's helps with pigment and helps with color. I think those are probably here, the things people love the most. Anything that rejuvenates your skin with minimal downtime. I think things that with higher downtime are really not as popular, like CO2 lasers or more ablative lasers. I think people want minimal time
Yeah.
out.
That's good. And then do patients ever come in like asking for like celebrity influence kind of
So there was a while there where everybody wanted Russian lips, and that's the only thing I've experienced. Most of my patients just want to look more natural and rejuvenated. And so I don't really see that. But I also have a very different patient base who come in to see me. They don't want anybody to know they're doing anything. They want to look refreshed, rejuvenated, and they don't want anybody to know they're doing things most of the time.
yeah, and I like that.
Yeah. I feel like we all we want enhancement, we wanna take years off, but we don't want anybody to really notice. It's
I woke
that's the
up like
key.
this. Is
Exactly.
yeah.
Exactly. It's all natural.
And have you ever refused to operate on somebody?
So I wouldn't say refuse, but I
Okay.
do when I have a consult with a patient. I mean, I pick my patients. If you're not going to have a great outcome, I explain. And if a patient's not going to want to do the blood work, and I have had two patients where I gave them back their deposit where they said they were going to, and then they just never did. And so I think I'm a doctor first. I say that all the time. We've got to make sure that you're a great candidate, that there's nothing else wrong. We've got to make sure you're going to heal well and you're going to have great outcomes. So, so really, other than that, I feel like that's just good medicine.
Okay, well, side note, ladies, just ask and look for in your next aesthetics clinic is how much are they going to care about your pre and post? I
Right.
don't even think about that. I just think, oh, I'm going to go in there
No.
real quick over the weekend when I have time and then get the heck out of there.
Exactly, and I think that's so important is what you're doing, what your hormones are as far as that has a huge impact on your pigmentation risk, and so, your skin color, you have to be really careful with doing too much energy because you're gonna have then more melasma risk because it's hotter. So you really have to be careful. My sister has, melasma as well, and she went to a friend of hers that did blue light, laser on her, and her melasma just, took off. And so that's not something that everybody can do. You really have to be careful on what your provider needs to analyze your skin, analyze a lot. It's not just your background. A lot has to do with, I think, your hormones. So I can look at somebody and I can tell by looking at them based on their hormones that they're on, looking at their skin type, and I can tell how their body's going to respond. So I always do less energy for patients that I know have a skin type that has a higher risk of hyperpigmentation because they don't need as much to get better results.
Oh my gosh. Like,
Mhm.
so on some of your blood work, I'm imagining you're pulling also a hormone panel.
Absolutely.
Oh, wow.
Abs and so even my so I do weight loss. And my weight loss patients, I make them do their scale because if they're not taking androgens and they're on a GLP, they're gonna lose their muscle mass. The only way to put on muscle past 30 is hormone restoration. And not everybody, right? I mean, genetically, African Americans, they look 30 at 50. I mean, they look amazing. Their hormones are great longer term. So everybody's different. But it's very, very important that you have balance. You have optimal cellular health, but you have to have testosterone there. You have to have DHEA there. You have to have progesterone there. Progesterone is a balance of estrogen. So perimenopause, women tend to gain more weight. They have more inflammation in their skin, and it's because they're higher estrogen, lower progesterone, lower testosterone. That impacts your aesthetic results. That impacts your skin quality.
Yeah, well,
That impacts your weight.
all these
Yeah.
equations running through your brain, like,
Yeah.
you haven't even spoken or looked at anyone's results, you're just, like, looking at them and you know all these things, like, right away.
I know. My brain does connect.
I love that. Okay, so what do you think there's a wrong reason to get cosmetic surgery?
Well, I think everything you do is for yourself. I feel like I really don't think there's a wrong reason, but I feel like you need to make a decision on the journey that's gonna ultimately give you the results you want. So, I think everything we do is for ourselves. As long as it's for yourself, you're fine. And as long as you're a great candidate and you're healthy, then I think that's great. And you have a good supportive provider, right? You want to find somebody who can support the surgeon. Not all surgeons have a pre and a post team. You really need that. You want to find, I tell patients, even my breast cancer patients, when they go away and they do surgery, I make sure that they see a physical therapist before and post. If maybe I had done that, I would have noticed my deficit sooner. It was COVID, so probably had a little bit to do with it, but your body changes post surgery. So you really need to have somebody on the journey to help you in that way.
Therapist. Wow.
Yeah.
Pulling in all the tools.
Absolutely. And the nice thing is in our world, we have such good connections. I've been in this community for, I don't know, 23 years now, so it's a small town. We know everybody. And I think in your world with all the providers, when we get together, it's become a small community too. And so, yeah, for sure. Having all that support is important.
Well, it's you meet a lot of personalities in the medical space, especially
Mhm.
providers, but the majority of them are very secretive about what they decide to share. And Dr. Booth, I think the reason you're loved by everybody is because you share without abandon. Like you're not safeguarding anything. Like it's just wonderful to see.
I've been so lucky because I've never experienced that. Like, I feel like maybe it's because I do too, but I feel like we make each other better. And so my knowledge that I can share to make your life better, I feel like there's enough patience and there's enough for everybody else. It's like Dr. G helping us with his knowledge, right? I mean, everything makes us better. So,
Those are real connections that you make, and, like, I
yeah.
remember I was sitting with you and Dr. Neff, who's another elite,
Oh, she's amazing.
and, you guys are very close friends now, but you were talking about, like, how Dr. Neff just got her like, your favorite laser.
Oh,
I know,
no.
yeah,
I'm oh, no.
so jealous about the la and I was like, What are you talking about? What is this laser?" And, yes, let's talk more. Like, that
Oh, no. She got my favorite dream laser. I'm so happy for her.
That's so cute. I love that. Alright, so what do you have any, like, opinions on the beauty hypes that are, like, very overhyped right now, maybe not as effective as you would like to see?
I mean, honestly, I think everything is gonna improve. It just depends on what you wanna spend your money on. And so, that's the thing. And so what I tend to do when I have patients is I talk to them about what their end result is and like I'm not a big fan of threads. And I explain why. You get immediate results, but it's very short-lived. So I think if you have enough money to invest in all these things, then go for it. But otherwise, I think picking something that stimulates your collagen, that improves your skin quality, that kind of rejuvenates along the way, no matter what you pick, I think it's going to help. I think some things are a little better than others, but I think as long as you have some form of energy device, like radio frequency, IPL, or even the ultrasound therapy, right? All of them are going to improve your skin quality. So your provider may use different things, but it probably in their hands, it's a really good product. So I always say, if you have a good relationship with whoever's you're seeing, look at their results because it really, I use the Patens. I love it. I've never had a terrible outcome, but I have patients who are scared of microlinear radio frequency. In my hands, you're going to have, no matter what your skin type, you're going to have incredible results. And if you put a biostimulator like Radius with it, it's going to be blow you out the park. So I really think it depends on the provider, their clinic, what they're using. If they're skilled, you're going to have amazing results because they're not going to want you to spend money, not get results because you're not going to go back.
Yeah, yeah. Like, ultimately, the
Mhm.
provider wants you to look the way you
Mhm.
wanna look, yeah.
Exactly.
Okay, well, that helps. I also feel like it's kind of just you're talking about the threads thing, and I do actually agree with you about the fact that they are overhyped. I read some
Yeah.
also cause a lot of fibrosis, and what is your
Mhm.
stance on fibrosis over, you're using things that have rejuvenation involved,
Yeah.
collagen building, but what about the scar tissue?
And I think there's a little less control with threads. So I do biostimulators, which produce fibrosis, right? They produce fibrin deposits, collagen long term. And I really think it's the skill of the person doing it because I really have incredible results with what I do. It's micro droplets that we do. I think if you're going to somebody where they've done a lot of it, and they feel confident and have good endpoints, then I think that's what you should choose. And so I like to really, and it's not an overnight. So a lot of patients will come in, they'll only want to do one and expect to look like a different person 2 weeks from now. And so I think you have to have realistic expectations. Biostimulators, they take 6 months to notice improvement in collagen. And most people don't. I show them the before and afters and they're wowed, but they don't notice it. And so I think if you pick a therapy that's gonna improve your skin quality over time, then even just staying looking like you are right now is your goal,
Yeah.
right? We don't want to age. And so if you look the same this year as last year, I feel like that's a win. Yeah, exactly. And if you want to do more and you have, more to spend. So I tell patients, what's your budget?
Yeah.
When you have a budget, because you want to do things for yourself and you don't want to feel guilty about it. They give me their budget, we work within it. Ultimately, in 4 years from now, they're gonna look so much more youthful than they do right now. And that's the key.
Oh, I love that approach. That's a fantastic approach. And he did mention that any woman past the age of 40 needs to do it, some kind of RF microneedling. I'm like, amen.
Absolutely. Past 30 once a year, past 40 twice a year.
Oh my God.
So all the collagen that you lose in a whole year, you get in one energy based device microneedling. So yeah, absolutely.
I like
The glow, like, it just looks so good. I love it. Within 3 days, you're looking great.
you're absolutely right though. I never thought of like, hey, if I just look the same next year doing something
That's a win.
that's a win. That's all the loss.
Absolutely. We just wanna stop and stay right here. Yes, it's good to do it a little backwards, but it's okay to just stay here.
I love that. Okay, so have you ever experienced like a super emotional patient journey? Because you're doing a 360 care for these women. And
I have
this is a
so many,
for decades. So
absolutely. I have so many that I'm thinking of right now. I mean, I have one I just saw recently, and I've been taking care of her for over 15 years. I'm gonna take care of her family. And, when I met her, she was emotionally distraught. Physically, there were things going on. And on the journey, we've had ups and downs. Um, and right now, we were at a really good point with her. So I do. I have so many that I can think of. I have one recently that moved to California too, that I set up with another friend of mine who came in and was just crying on the day I met her. And it was a journey, right? I mean, I think as women, particularly in perimenopause and menopause, nobody acknowledges what's going on. Everybody tells us we're normal, we're fine. And so a lot of those are my patients that find me. And when I start to help them feel better, acknowledge that what they're feeling is truly what they're feeling and that we can fix it and change it and improve it, they're empowered. And that's when they tell me that I've saved their life, I've saved their marriage, I've saved them as a parent. So I have so many, honestly. I feel very privileged to be able to do what I do every single day because I feel like they give me as much back as what I'm able to help them with.
Oh, that's so beautiful.
Yeah,
There's so many friends going through some crazy hardships right now. So
absolutely.
like, I'm at the stage in my life where everyone is having babies, and their marriages are all like they had babies, maybe a couple of them, and their marriages are just down in the dumps. Like that is not a priority. And there's a
Oh,
lot
absolutely.
hormonally. I'm
Well, especially when women are nursing, they go into a menopausal state hormonalized, right?
Mm.
You suppress your estrogen. So a lot of women don't realize that. But in order to actually be a good nurser, you don't make estrogen. So a nursing mom um, is basically a menopausal woman. And so it is a struggle. They're not sleeping. Remember, we know sleep is everything,
Yeah.
right? And you're waking up a lot, you're not sleeping. Um, a lot of women have postpartum depression. Hormones are all over the place. You go from this high progesterone to no progesterone. And so it's a hormonal balance as well.
That's
So,
just so many
right.
things. I'm
I
like,
think every aspect of life. I think this, and a lot of women don't realize that we drop our hormones at 25 to 30. Perimenopause is in your 30s and 40s. It's 15 years prior to menopause. And so I see women every day who walk in here feeling anxious and feeling like they're losing their mind one month and then the next month they're fine, feeling tired, gaining weight. I mean, that's a struggle too. And I think it's right in the midst of childbearing. Then you have a kid and then you have another kid. And it really is a big strain. You're working, you have so many other things going on. And so this is part of what I love to do is help these patients through their journey.
ah, so beautiful. Are you able to see people like telemedicine? I know I'm gonna get that question.
Yeah, actually, it's I do. I've actually got my license in a number of states because a lot of my patients have moved and they haven't found anybody. So I am. So I have Colorado, I think North Carolina, I have Texas, and I have a few others that are pending. So yeah, I am.
Fantastic. That I think our listeners are gonna want to have a conversation with you for sure. Okay, we're gonna shift gears out of skincare. I think this is a good place. Is really this women's health, right? We kind of
Mhm.
touched upon this. You've seen it all. What do women under 50? Now you just gave me this giant pearls that
Mhm.
we're probably already in menopause, but or on perimenopause. But women under 50, what should we focus on to set ourselves up for better chances to get while we're moving into a menopausal
Yeah.
age?
So, I mean, women under 50 really need to be on testosterone for sure. Most of them are still in perimenopause and they need to have good progesterone there. Even if you've had a hysterectomy, micronized progesterone balances estrogen, it's neuroprotective, it's decreases insulin resistance, it hits the GABA receptors, so you sleep better. Your vaginal tissue is better. You have less hot flashes. So, a lot of patients feel like they're in menopause, but it's really perimenopause. So we have to get our androgens right, right? Testosterone, Rebecca Glasser is a surgical oncologist in Dayton, Ohio, and she published a huge study in 2019, 10,000 women, and it was a reduction of breast cancer by 40% on testosterone pellets after 2 years. Currently, I think that they're year 15 and it's a 45% reduction. So it's a P53 gene um, a modulator. So testosterone really decreases. It should improve risks of breast cancer, prostate, colon, and squamous. Those are all P53 gene. And so testosterone has been shown in multiple studies to decrease breast cancer risks. It also decreases a lot of inflammatory risks, like C reactive protein goes down. And so a lot of my autoimmune patients after 2 years of therapy are better. So remember, testosterone is important for deep sleep. It's important for muscle mass. It improves tone of your ligaments and your muscles. And so all of that decreases risks of neuroinflammatory disease as well, right? So along with having good cell membranes, you've got to have good hormones. If you don't have muscle, that's your longevity organ. And it's really hard for women to put on muscle without testosterone. Men can still produce it later. A lot of men do drop by a good percentage by the time they're 40, but we don't have any ability to make testosterone past a certain age. Men can do Clomid, they can do other things, particularly if they want to continue with having fertility. But women, there's no way to upregulate our testosterone.
Except with bioidentical hormone therapy.
Exactly.
You also treat men. I do want to make that clear. Like you're an OB-GYN who also has treated several men, and now you have a lot of men in your patient book.
Yeah, so I was had all these women that I was fixing, and their men were like, "Hey, what about me?" And as OB-GYNs, the men come to the appointments because we become family. So that's why I started to treat men about 15 years ago.
So what about men under 50? What do they need to worry
Oh,
about?
same thing. So men typically get their estrogen from testosterone. So they aromatase their estrogen. Remember, estrogen is very cardioprotective. So if you have low testosterone, you're going to have low estrogen, and that's going to increase cardiovascular disease. In women too, that's why we need estrogen. It's very cardiovascular protective. Men too. So men start to drop their testosterone at around 40. Some men, depending on their stress levels, I've had men in their 20s with low testosterone. So, I do think men over 40 should get their levels checked. It's endpoint disease. So, a guy in his 50s may feel great. He may have no sexual dysfunction, but I guarantee you that more than likely his overall free testosterone and estrogen is low. And so, by the time you have issues, by the time you have ED, that's endpoint disease. We want preventative. So you want to add testosterone before disease happens, and just like what we're talking about cell membranes. And so women, really, you want to start in your 30s. Men, you want to start looking, and the ones that find me, they're the athletes. They're the 30-year-old female who've always put in this amount of work, this amount of nutrition. They're very clean eaters. Everything's regimented, and they're just not putting on the muscle. Men, it's at 40. They're not seeing me because they don't feel good. Everybody else waits until they're not feeling great. Yeah, exactly. So the key is, if you start early, yeah, that's more preventative. So I think by 50, most men, when we look, are probably low. And again, they feel good overall, but they can feel even better. So it's worth looking. And the other thing I like to remind everybody is labs are based on age. Everybody's going to tell you your labs are normal if they're looking at your labs because it's based on age. We don't want to be normal for our age. We want to be optimal. And so you have to see a doctor who understands bioidentical hormone therapy and integrative health and this aspect of health. Because 100% of what I used to tell patients who are perimenopause, why would I look if I wasn't going to do anything about it? If you don't know, there's no point, right? So you really have to find a provider who understands, who doesn't get the dogma of, because most doctors think that this just causes heart disease, cancer. I hear it every day. I'm still having patients come being placed on synthetic progestin. I had patients being put on Provera, which we know increases breast cancer risk, right? We know synthetic progestin increases breast cancer risk. Not one person should ever be placed on a synthetic progestin. And so you have to, I think patients are their own advocates now. That's what drove me to do what I do. I had a patient tell me to figure it out because clearly I could have seen she's improved so much. And so patients need to find a provider who understands. And we're not all cookie cutter. Everybody is different. For women, we know supraphysiologic is good. And then you've got to find that sweet spot. It's not, men, it's easier. They all need to have an estrogen of a certain level and a testosterone. But women, we treat supraphysiologic and we treat based on how we feel. Deep sleep, it helps with joints, helps with moods, helps with libido, helps with muscle mass, helps with so much.
I would imagine then when you get these women who have constantly been told everything's fine, they're normal, they come see you, you're like, okay, what is your sleep like? What is your mood like? What's your energy like? And they're describing these things. It must feel like you're reading their minds almost.
Most of them cry.
Mm.
They feel like they finally have somebody acknowledging what they're experiencing and that they're experiencing some normalcy. So, yes. And then they come back and they're like, Dr. Botha, I'm so mad that I didn't know about this.
Mhm.
I'm so mad that it's taken this long. So yeah, my goal is to educate as many people, and my goal in my office is to educate patients on their bodies,
Yeah.
how they're feeling, and why they're feeling the way they do, because it makes it less scary. And so I think patients just have to find the person that understands this aspect of health. And I never knew this before, so it's not something we're trained in traditional medicine.
No, no. We're trained against
Mhm.
it.
Right, 100%.
Pre-summit. Okay.
Yeah.
Well, we can't forget about our women 50 and up. So
Yeah.
I would love to ask the same question of that. What should women 50 and up say? Is it similar watching those testosterone?
So women need estrogen. We don't want to go off estrogen, right? We know that if you are on estrogen from menopause and you keep it for 10 years, your risk of vascular dementia decreases by 85%. Risk of osteoporosis decreases by 35%. Risk of UTIs or urogenital sepsis decreases by 60%. All cause mortality decreased by 30%. And so we don't want to wait years. It's okay if it's been years to start. You're still going to have a benefit. The best benefit is never losing your estrogen. So my patients who are perimenopausal approaching the age, I will start them on a low dose estrogen therapy because they're dropping. So we want to keep them feeling good. We want to keep their risks of arterial disease low. We want progesterone there, right? Perimenopause, you start waxing in your progesterone levels. And so that's needed in menopause as well. And then again, testosterone, very important. As we get older, we lose our muscle. We get frail, right? The risk of breaking hips and fracture is huge. And so we want to maintain our muscle, our bones. We want to maintain our endurance and our vigor. And we do this by making sure, yes, we're doing everything that you guys teach, but starting those hormones and not being scared of them. Look at the data. Just go. I tell my patients, this is where you can find all of this information, but this can change your life. And the medical professions are the hardest. But when they go out and look and they start and they notice, their doctors see the transformation within their blood work, right? I mean, you can change a lipid panel by adding estrogen. Estrogen is so important for our overall lipid health.
That
I've had patients, one that I was thinking about when you asked me, the patient that made a significant difference, and I have so many, but she came to me with osteoporosis. She doesn't have it anymore. Yeah, she's in her 80s. She doesn't have osteoporosis. When I met her, she had osteoporosis, she had vaginal atrophy, she had urgency, and she felt like she's funny. She told me she was homicidal, but she's lovely. I love her and her husband, and she's a very different person now and does not have osteoporosis. And we tell people that we can't reverse it. Here is a patient who I've seen.
there's so many conditions that are irreversible, but
Yeah,
that's people are overcoming.
yeah,
Uh,
absolutely.
wow, that's incredible.
Absolutely.
Uh, and she feels better now that she's older,
Mhm.
which is the most incredible piece of all of this.
Yeah.
Oh my goodness. Okay.
That's I think I mean, I started doing this at 35 and I was very clean eater. I did CrossFit, I did paleo. I would just look at carbs and gain weight. And I started bioidentical hormone therapy when this patient had brought it to me. And after a month, I was like, oh my God, I felt like I was at a yoga retreat. I was like, what is this and why? And so I started it and it made such a difference to my life. And that's when I wanted to get it out there and have all my patients understand the value and importance. And I'm 53 now. So it was a long time ago.
You do not look it, doc, at
Oh,
all. Okay, so
thank
how much
you.
hormones are you doing with women, like, starting to think about fertility? Are you taking them off hormones? Are you, like, doing it for a short amount of time? Anything like that?
So, I mean, in my my corporate practice before, I had a lot of patients with endometriosis. And endometriosis, right, is estrogen dominance, and they have a hard time having sex and having painful sex. And I actually would start them on testosterone therapy and progesterone therapy. We'd operate, get rid of the endometriosis. And when they got pregnant, we just took them off the testosterone. And so it really depends on the patient. So testosterone, you don't want to do second trimester, but when you get diagnosed and you have a positive pregnancy test, we continue to support with progesterone, but you then you just stop your testosterone. So a lot of what I see are more hormone infertility patients, right? So PCOS, and a lot of that is more insulin resistance and egg quality. And so again, decreasing insulin resistance, improving egg quality, it helps with cycle regulation.
Oh my gosh. There's probably a episode on its own just as how much you know about the fertility and fertility battle. Because that's a big headline. Like we're just
Yeah, and it
babies.
absolutely. And so, back when I started, I mean, this was my cup of tea because personally, as somebody who has polycystic ovarian syndrome, I know it's not called that anymore, but I definitely I'm sorry, I saw that in more of my patients that were struggling, particularly athletes, and had a hard time getting pregnant. And so it really is related to hormones. There's so much in that, to get patients pregnant. It's not just about ovulation, it's about making sure they have good egg quality so that, it's a good pregnancy, and with you guys and your plasmalogens, it just adds to that, right?
Gee. There's so much that I know now, like, because I went through my own IVF journey and it was unsuccessful, many
Aw.
times, and they didn't even look at this. Well, of course, they
Mhm.
they tested my hormones, they did all of these things, but they are not looking for PCOS, they are not looking for endometriosis. They are just
Mhm.
finding a level and then putting me straight on all these, very expensive
Yeah.
drugs that just, like, it's again, just get in and get out.
Well, and if you're insulin resistant, you have a higher risk of miscarriage, right? So your hurdle you think is just that positive pregnancy test. But if your egg quality is not good, then and that's just another struggle. So for me, even back when, I mean, back before GLPs, we did metformin, we got that insulin level to less than 5, and my patients would get pregnant. And we would support them with progesterone. So I had really good success in that patient population. And it comes down to, again, I mean, looking and practicing root cause medicine.
Understanding all of these.
Yeah.
You're very few and far between though, doc. I know that you're very complimentary to other providers who are treating similar things, but like no one's looking at it through the same lens as you, I have to say. Major key takeaways here. The one of my favorites that you said today was that the skin is your relationship to health. I think that's so beautiful.
Mhm.
I think it needs to be a big giant, tagline on your wall. Like
Yes, for sure.
oh, such a beautiful line and such
Yeah.
a beyond just, looking good and the aesthetic part of it. It is truly like a barometer of
Right.
what's going on inside. That's wonderful.
Absolutely.
I promised our watchers, our viewers, our listeners, that you're gonna do one of these fun, VAR
Okay.
rank A
Let's
to
do it.
F with my list. Okay, so we're gonna start
Okay.
first. Rank A being you're doing it, you're about it. You might not do it,
Okay.
on it, but you love it. And F being, hey, stay the heck away from this thing.
Right.
So chemical peels.
B.
B. Okay.
Mhm.
Why? Why not A?
I so I think it's very individualized depending on your skin type. You get good results, but it's not as consistent. You can't do it all year round, right? You can't do it in the summer. And I'm in Florida, so most of my patients, it's a no go. So that's why I give it a B. I think if you're up north, maybe it would be an A.
Yeah, that's good to know. Geographical
Hmm.
location. And
Yes,
what the all
exactly.
right. Fillers. So A, biostimulators. So Balafol radius. Love. I love with hyaluronic acid, I would give Redensity an A. I'm not honestly a big fan of anything with Vycross, so I'm not a big fan of Juvederm and Voluma, so I would actually personally give them an F. More because I've had patients with a lot of inflammation with that. I know a lot of patients do well, but personally, no. Very good to know. Thank you for that. All right, Botox.
Love Daxify. I'd give it an A.
Dax.
Juvederm, I'd probably give it an A minus.
Uh,
Zeman, I'd probably give it a B. And Dysport, probably B plus. Sorry, Juvo, not Juvederm. I said Juvo. Juvo. Juvo.
You know them all, and it's like at the tip of your brain, just ready to fire off. Like,
We all have our favorites. So my favorite is Daxify and Juvo. That's what I love. And I love it because it doesn't spread. So it keeps where you put it, it stays. So patients get a very natural look, right? They don't look like they've had Botox. That's the key.
that's very good. I like this. Okay, laser resurfacing.
So I love Pico laser. And I also actually love plasma energy because it is ablative, but it's very superficial.
So would that be an A or an
A. Sorry, yes, A.
A? Awesome.
A for both.
For both, for Pico and for plasma energy.
Yes.
Awesome, awesome. Very good. Ladies, we got to get our lasers. Red light masks, the at-home ones.
I mean, probably a B. If you do it every day, it's good. If you, I think the consistency is the issue. I love red light. I have red light here. My patients participate. I think it's how often you do it. I think if you're doing it on a consistent basis, morning and night, then I would change my grade. But
Very good. So one off,
yes.
just don't even bother.
Right.
Okay. What about thermage?
B. I think radio frequency is good, but I like it in other devices.
What about Morpheus 8?
I would give it a D for pain and a B for results.
I hear it's super painful.
Yeah, so when I picked what I picked, I tried different ones, and nobody would have come back for that one. Not in my patient population. My patients do, I give them, Pronox for whatever they want, and so I think I would lose patients with Morpheus.
Yeah. Good to know. It hurts.
But results, I mean, they're great. I think any kind of microneedling device is good.
What about Old Therapy Prime?
B.
B.
I think ultrasound therapy is good, but yeah.
Yeah. It hurts.
Yeah.
It hurts a lot. IPL.
I know you did it, right?
I did.
Your skin's amazing.
I can't say I wanted to go back and do it again because it hurts
Yeah.
so much.
And that's the thing is we got to pick things, or I have a 20% lidocaine cream that I have for a pharmacy here that I put on an hour before, and patients are then fine. But you really have to get good treatment before.
20%. Okay. Okay. Very good.
I could give you that information if you need it.
I think I do. IPL.
It's B. Same thing. It's one of those things that in Florida, I'd say 90% of the time we can't do, but when you do it, the results are great. It's just can't be in the sun.
Awesome. So I did have threads in here as a grade.
I would say F. That is my F right there.
I like that. What about Regeran? That's the salmon DNA stuff.
So I give it a C, not because I don't think it has great results, more just because of you really can't inject it in our country, unfortunately. So microneedling, I get great results, and I know a lot of people are, but I think there's a lot of issues with injecting. So I give it a C.
Okay.
But microneedling, A.
Microneedling is an A. Okay.
Mhm.
What about hydrofacial?
B. I think hydrofacial is great, but yeah, I think a regular facial is great too.
Would you do a regular facial over a hydrofacial?
I mean, I think so personally.
Yeah.
Yeah. I just have such sensitive skin, right? And so anytime you have a product getting placed, I know my skin's gonna react. So
Well, that there you have all the
yeah.
top Googled procedures that we as women get. This has been such a great, just a
Oh,
enlightening conversation, Doc. Thank you for all of the knowledge that you've shared.
absolutely.
And so we're gonna have all that information about how they can speak to you, how they can talk to you directly That's like Dr. Tracy Botha, OB-GYN, cosmetic surgeon from Moy, a medical spa out in Gainesville, Florida. She's got some states under her belt, hopefully getting some more. But yes, she's truly like exactly the person that have seen and heard from today. She is that in person and then some. So highly recommend you reach out to her. We're proud to call her one of our own elite practitioners. And thank you so much for your time.
Aw, thank you so much. I always enjoy talking to you.
Awesome. Well, have a great weekend and
Okay, bye, you
see you
too.
in the next one. Bye.
See ya.